Are you bleeding too much, too long, or at the wrong time? Let's talk about why you're having abnormal uterine bleeding. Abnormal uterine bleeding is scary. Untreated, heavy, or prolonged bleeding can stop you from living your life to the fullest. Abnormal bleeding also can cause anemia. MENORRHAGIA is the medical term for heavy periods. You might have MENORRHAGIA if you have a menstrual flow that soaks through one or more pads or tampons every hour for several hours in a row, or if you need to double up on pads to control your menstrual flow, if you need to change pads or tampons during the night, if you have menstrual periods lasting more than 7 days, if you have a menstrual flow with blood clots the size of a quarter or larger, or if you have a heavy menstrual flow that keeps you from doing the things you would normally do. And last, if you're tired, you lack energy, or are short of breath, you may have menorrhagia. Abnormal bleeding can be caused by problems in the uterus, problems with your hormones, or bleeding disorders. Uterine-relating problems include growths or tumors in the uterus that are not cancer, like fibroids or polyps. They can cause abnormal uterine bleeding. Fibroids are hard tumor-like growths on or in the uterus that can cause heavier than normal bleeding and may cause more pain during your periods. Polyps are soft growths within the uterine lining that can cause abnormal bleeding as well. Endometriosis is a condition in which cells from the lining of your uterus are located outside the uterus, and that can also cause abnormal uterine bleeding. Endometriosis also causes severe menstrual cramps and pain between periods, like pain with sex. Cancer of the uterus or cervix can also cause abnormal uterine bleeding. Cancer needs more blood than normal cells, so abnormal bleeding can be a sign of cancer of the uterus lining called endometrial cancer, or cancer of the cervix, which is the opening to your uterus. Getting regular pap smears are the best way to prevent cervical cancer, as a pap smear can detect very early cellular changes. And certain types of birth control, for example, the intrauterine devices, can cause abnormal bleeding. Copper IUDs especially cause heavier periods, while progestin IUDs can cause bleeding in between periods. Hormone-related problems are the other issue. Abnormal uterine bleeding can be caused by ovulatory dysfunction, which means you're not ovulating regularly, or you don't produce enough progesterone to stabilize the lining of your uterus. This causes your uterus lining to shed randomly. Bleeding in between periods, after or during sex, or even vigorous activity can be a sign of hormonal imbalance. It can also be a sign of an STD. If you want to have children someday, pay attention. STDs can cause pelvic inflammatory disease, which can cause scar tissue in your fallopian tubes that will prevent you from becoming pregnant or cause an ectopic pregnancy. An ectopic pregnancy is when the fetus starts to grow outside the uterus, which is not safe. First trimester miscarriage can also be caused by low progesterone levels, so if you're pregnant and bleeding, you need to be seen by a healthcare provider right away. Another serious hormone-related problem that can cause heavy bleeding is a prolactinoma, which is a pituitary tumor that produces too much prolactin. Although prolactinomas are benign, they can grow big enough to cause severe headaches and interfere with your vision. And remember that most women dealing with hormone issues need support. That's why I offer our free hormone support group as part of your hormone reboot training. Just sign up and join the conversation. Now, there are other illnesses or disorders that can cause abnormal uterine bleeding. Bleeding-related disorders, such as von Willebrand disease or platelet dysfunction, can cause your blood not to clot properly, so every period can be like a hemorrhage. And if you have liver, kidney, or thyroid disease, you can also have heavy abnormal uterine bleeding. Stay tuned for my next video on how to treat abnormal uterine bleeding.